Welcome to another episode of Bite Size Dental Marketing. My name is Ian. I'm here today with the absolutely incredible, multi talented wizard in the dental marketing space. Saurya, thank you so much for joining us again.
Thank you. I love being here.
So today we're going to chat about something that is a common question in our space is why do dentists need dental marketing? We get this question all the time. We have dentists saying, "Well, why do I need your services?" Or
That's a fair
even,
question. Yeah.
of course, and we'll tell them, don't you doubt that for a second. But that's a question that we regularly get is this worth it? Why am I doing this? Is it just me being a good dentist and I get more patients, or do I actually need dental marketing to help me to reach the new patient or the production numbers that I have in mind? So, as my first guest who I ask this question to, Saurya, what would you say if, as a dentist, I came to you and I said, Saurya, why do I need dental marketing?
Well, I would answer that question to start with, I would say something very similar. And simple. Before going into the details, if you believe that people should come to a specialist to get a specific treatment done, then why wouldn't you go to the specialist of marketing instead of trying to handle it yourself?
Ah, okay. Yeah, yeah,
Right?
yeah, 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 yeah.
Yeah.
Why try and handle it yourself if there are specialists out there that know what they're doing,
Right.
that have the best possible way to help you get to where you want to be. And a big thing tying
Exactly.
into that is we always say you focus on being a dentist, and we'll help you with the marketing. And we actually tested this. For those of you who don't know, um, rest in peace, but we had a product called the Marketing Box. And the idea behind that was dental practices doing their own marketing. We would send them a box
Mhm.
with instructions from A to Z. And Saurya, how did that go?
Internally, it was a lot of fun for us to work on it, and it was a nice project because
Hmm.
the team came together. But the response to the product was not as well as we'd hoped for, because turns out marketing is a lot of work. It's not so easy
You
to
don't
do
say.
DIY.
And I mean, the biggest feedback was the issues that we had with the internal staff not wanting to
Mhm.
have a job on top of a job.
Right.
And that's one of the big things that I would say. I mean, many dentists have asked me this. Ian, why would I need dental marketing? Why should I pay someone to do my marketing? Well, the most basic answer is no one in your office, unless they're as enthusiastic and optimistic to try new things like Saria, to step out of her boundaries as always.
There's
Most
nobody
people.
more enthusiastic about SEO than Ian. So,
Then most people, they want to go to their job, they want to do their job, they want to do it right, they want to do a good job, and they want to go home to their families like that. That's what,
right.
or to their pets, whoever is waiting at home. And that's what we saw in a very real way with the marketing box. They don't want to have a job on top of a job. So the idea of now saying, okay, my receptionist, you are going to uh, help us with posting to social media, hygienist or whoever who's willing to write a blog once a month. That's not something that people are wanting to do. And just that alone to me says this is why you should hire a dental marketing company, because focus on being a dentist, and we'll focus on helping you get to where you need to
Absolutely.
be.
Absolutely. And what's funny is people often associate marketing with one aspect of it, which is um, it's a common misconception. Some people might think that just advertising is marketing. Others
Hmm.
might think
Posting to
posting on
Instagram is.
Facebook or Instagram, yeah, that is marketing. But
Why do
in
I need anything
reality,
else? Sorry, why do I need anything else?
exactly. I'm already posting photos on Facebook. I'm doing great. Well, it is an important aspect of it, but it's definitely not all of it. And I think with a help of an agency who does this for their day to day, we live and breathe in marketing. I think it is
Hmm.
to think of that contrast of what you might perceive marketing to be and what it really is
Hmm.
very different because, I mean, we have on an overview perspective, we have the trifecta of marketing. You would have your owned media, which is your website, your listings, the way you communicate with your existing
Hmm.
or prospective patients about who you are digitally. Then you have your earned media, which is SEO and organic publicity that you get out of not paying for publicity, even
Hmm.
word of mouth or referrals. Those would also be your earned media. And then we have paid media, which is the paid advertising promotion that you actually pay for. And those are just the high level facets of marketing. Now think about all the things that goes within those aspects.
What are the three things, um, on a basic level, that we can explain to a dentist? These are the different categories of marketing and why it's more complex than most people think.
Yeah, so the first one that I mentioned was your own media, which
Hmm.
is, you might not consider that marketing all of the time, but it is because it's you broadcasting who you are and your message and what your practice does. That would be your website,
Hmm.
where you have all the information about what you can offer to a potential patient. Even on a something that's not digital, that would be your pamphlets or your brochures or your
The
even
postcards,
billboard
yeah.
or
Hmm.
signboard outside the practice. Those are all your own media. And there is definitely benefit of knowing how to use these owned medias to communicate to your not just existing patients, but also your prospective patients. It has an effect on people who might
So
potentially
important,
be
so
a
important.
patient.
Yeah,
Right.
yeah. Especially if
Yeah.
they're finding you by means of the next two categories that we're going to talk now. The owned part is essentially your brand. It's who you are. It's if someone
Yeah.
finds you, what you look. And we can touch after you spoke about the other two. Now we can touch again on that. But I definitely want to talk a bit more about, if someone finds you, are you ready? That's another reason why dental marketing is
Hmm.
important. If somebody finally finds you, are you ready? But before we get to that, please continue. So there was the owned media. Then the second one that you mentioned.
Yeah, the second one that I mentioned is your earned media, which is the things that you have earned publicity or promotion through without having to pay for it, which is your
Okay.
organic visibility on digital. It would big aspect of that would be SEO because you're
Okay.
being visible to people without having to directly pay for their clicks or their views. And that would also extend out to in person people, mouth to mouth referral. People are
Hmm.
um, talking about your existing patients are talking about you. That is another earned media that you can utilize. And I really like something you mentioned, Ian. I think it is so important that all these different pieces work together, because somebody who does find you through these other two aspects, like earned media or paid media,
Hmm.
they do need that owned media. They go through that journey of having to owned media basically bridges that person's journey from finding out about you to potentially walking through
Actually,
doors.
but yeah, walking through the doors, because it's one, as you're saying now, the earned media, putting in the time to write the blogs, to do the SEO, to have that incredible Google My Business. You're getting the reviews, getting the referrals, you're doing everything you can to make sure that people are actually finding you organically. And as you just mentioned, the paid media side, then, which is the next one, the next category that you had mentioned
Right.
about actually getting people to the site, that SEO, the organic, and then the paid. But then again, that the owned media, the one that you said at the start, if that's not in place, you do not have the right presence online. It doesn't matter how good of a dentist you are. If somebody that doesn't know you personally lands on your site and it doesn't look good, or it's missing information, there's 404 errors on pages, people are clicking and they're getting nothing, there's a problem, there's a broken page, that looks terrible. Then it doesn't
Right.
matter how good you are at paid media, at SEO, and getting people there. If you don't step forward when it gets to it, and you don't put your best foot forward online, why would I want to book you as a dentist? Why would I want to come to you as a dentist? Because you just don't look professional. So
Exactly.
I
Yeah.
really like that. I agree. I agree.
And if we think about it, there's so many. things that come into play when somebody's making that decision, the purchasing decision of coming to you as a patient. There's, even if, let's say, you're not doing any marketing efforts to grow your earned media or your paid media, somebody does find you through a referral. Somebody hears about you, or somebody posted about you
Mm-hmm.
without asking for it.
Mm-hmm.
There is so many things that could come into play from that point on to them wanting to actually pick up the phone, call you, and show up at the office. And you never know what facet or what things people put their value into or they think is important, to make the decision of picking you. Maybe it's important for them that they could learn about you and understand what kind of things you specialize in or what kind of
Mm-hmm.
experiences you have. Maybe they are somebody who struggle with dental anxiety and want to know how they will be treated before coming to the office. And all
Mm-hmm.
of those things are handled and made sure that are in place by marketing.
Exactly, because we have a few cases. I mean, Starlight Dental, who had specifically spoken to us about she's the no anxiety dentist. That's I think she has actually trademarked the
Right.
name no anxiety dentist, and just that coming in as a client, we know that that is important to her brand. We know it's important to the practice. Everything they do, it doesn't help you have this incredible practice, this incredible brand, and a message that you want to push, but then your online presence does not correspond with that, and it is difficult to achieve that. That's why, again,
Yeah.
I want to make this very clear to dentists that want to do their own marketing, that are passionate about it. There's no problem with that. It's amazing if you feel that you can do it, but it's very important to understand that there are multiple layers to this. That just as I do not understand how to conduct a perfect extraction or to place a
Hmm.
dental crown or how to do a root canal, I also don't expect dentists to understand how to run a paid media campaign or how to target specific keywords or how to
Right.
build that brand and those three categories that you had mentioned, because it's just not in your forte. And I come back to it again. The important thing is for people to focus, as you said at the start, focus on what you are good at and do that, and you will achieve the best results.
Right. Yeah. Let the experts do what they know best. And outside of taking care of all of your basic marketing needs, I think it's also a huge advantage, especially for something like marketing that's constantly changing, to
Mm,
get your input of people who live in it and have the insights around what is the recent trends, what are things happening, what kinds of things are happening,
mm.
what is happening in the industry. I mean, it's a huge advantage to be able to capitalize on somebody who knows that.
Perfectly said, sorry, because that just got me thinking now. Another massive part of having a marketing agency behind you, and as you said, someone that's in the industry that understands what's going on. How many times have we had clients come to us and say, "I'm having people reviewed me. They're on
Mhm.
affiliate with the practice. Someone left a bad review. How do I get rid of this?
Yeah.
Somebody just bought the domain that I wanted to use. What must I do? I'm trying to
Mhm.
get out of my contract." We have a particular media or marketing agency that we regularly get clients from, that it's difficult contracts. It's confusing contracts. The transferring of domains is extremely complicated, and you need to go through this and do this and do that. And for a dentist, I mean, that's a nightmare. I don't,
Mhm.
especially if you don't even know what it means to host a website and to transfer a website and domain and all of those things, to have to deal with that along with running a practice is terrible. So to have it not just a marketing team, but a consultant or a group of consultants that are experts, whether it's you on paid media, or whether it's SEO, or whether it's whatever it is, to have that group of experts behind you is extremely valuable when you
Yeah.
are trying to navigate this journey of marketing your practice and having a website and building your brand stuff. Because again, it's not easy.
Absolutely. I love that you brought those examples up because I can also think of things that happen that are issues that are more seasonal. One example I can think of is I know a lot of our dentists recently received this phishing email from Facebook, and they
I
were
got that last night.
basically,
I got it
you
last
did?
night. I got the same email, and the first thing I did, all of our dentists out there, please check the email that it's coming from. That is the first thing. It
Yep.
might say Facebook, but click down. Look, my one was AZZBBCZ5 at Gmail. And I was like, ooh, no, no, no,
Sounds
no,
about
no,
right.
not today. But excuse me,
Yep.
you were saying.
Yeah, no, absolutely. And see, not everybody knows that. I mean, imagine you're just going about your day and you get an email from Facebook saying something that you're using on your profile is copyright or
hmm And you
your
panic.
account.
You
Yeah,
panic, of
and you
course. Yeah.
panic. Imagine that. You don't know if this is authentic, and you're more prone to click on links or fumble around and try to figure it out yourself. Sometimes you might not click on the things that you're supposed to and get in trouble. And I think those kinds of things too, because we know that these things are happening at the moment, we take a proactive approach to let our dentist know, like, hey, if you see this come through, don't worry about it. Do not click anything, just delete it.
Exactly, exactly. And that, yeah, I mean, that's just yet another reason why looking at a marketing agency is could be so valuable to making sure the practice is successful. Another thing that comes to mind is competitor analysis, understanding the
Mm,
area that you're in. One thing I know that we often do, and that marketing agencies in general do, is looking at the type of services that I'm wanting to push in this area. Is it possible to begin with? Like
mhm.
if you're in, here's an example, if you're in a community with a lot of elderly people, like pushing Invisalign is not going to be your strongest suit, because I think
Right.
when I'm 70 years old, I'm I mean, I just don't care enough at that point to want to spend thousands of dollars on a cosmetic treatment or orthodontic type of treatment. And similar for in a student town, dental implants for missing teeth might struggle a little bit more than teeth whitening. So
Mhm.
understanding these things, and that again, marketing agencies have the understanding of, in these areas this is what works, because usually, especially in the States, you would have a marketing agency with multiple different practices or multiple different businesses. So whether that's marketing in dentistry, whether that's type of products they're pushing, whether it's beauty salons, whatever. If you have a chain or you have a one marketing agency running multiple ones, the beautiful thing is you can start to build up a data set. I'm sure similar to
Mhm.
with how you do paid media, you can start to understand these ads worked well here or this worked well here. You're not just
Yeah.
throwing something into the wind and hoping that it works or that it flies.
Exactly.
There's thought
Yeah.
behind all of this.
Absolutely. And it helps you understand, or I guess it helps us understand seasonality because we have eyes on all of these different things. We can let you know how the industry is doing and that maybe it's not just you. You might be wondering, what am I doing wrong? Because things
Mm-hmm.
are not going as well as last year. But maybe
Mm-hmm.
this year has looked different for everybody. Those insights definitely require some industry knowledge. And I think marketing agencies have that by virtue of having visibility into so many different offices.
Mm-hmm. Mm-hmm. No, that's fantastic. Saurya, thank you so much. I think to summarize everything today, there's maybe one thing I'm trying to think of the words, how I can put it is, as a marketer, I would not try and do a dental implant placement on myself, because I just,
Not
I
even
can't
a
even
chance.
begin to understand, or any dental treatment for that reason. So,
Yeah.
for dentists, again, if you have the passion, you want to do it yourself, and you think you can do it successfully, give it a try. But if I try and do an extraction at home myself, it might it might not end well. Um, but um, but that's where letting the professionals do what they need to do is often less costly at the end of the day than trying to do it yourself and failing. So
Yeah.
yeah, that's your bite size of dental marketing for the day. Saurya, thank you so much for joining us. It was fantastic having you.
Yeah, thank you, Ian. This was a fun chat.